On this Liver Day in 2024, it's quite pertinent that we are talking about this specific problem in young adults where there is a significant increase in fatty liver disease. And this specific term, which I've been asked to talk about today, non-alcoholic fatty liver disease, has actually undergone a sea change. The term is now metabolism associated steatotic liver disease, MASLD. This is specifically because alcohol has got a certain stigma attached to it, which is understandable. And not all liver disease is due to alcohol. So in our clinic, we see around about 300 to 350 patients every month in the liver clinic at Manipal hospital. Only 1/3 of them are because of alcohol. The remaining 2/3 are due to a non-alcohol cause. And this is where this non-alcoholic fatty liver disease comes into play, and the term is now MASLD, metabolism associated steatotic liver disease. This is important to understand because, as the term itself signifies, the metabolism in any particular individual is responsible for causing this fatty liver disease. And we all know about metabolic syndrome, which is high blood sugar, high lipids, being overweight, obese, and this background we know is responsible for causing a lot of heart and kidney related problems and also hypertension. But what is much less appreciated is that this metabolic syndrome is actually the cause of fatty liver. This is extremely important to understand, especially in South India and in South Asia in particular, and certainly South Asia and Bangalore and Karnataka, where we all live in. Although there is a big migratory population here, we all share the same cultures where our diet is rich in carbohydrate. And although exercise as a lifestyle change is coming into play, it is happening in certain pockets, and exercise is being undertaken in a, if I can say, an unregulated or ill-advised manner, leading to mishaps. We see that in the media now and again, and also alcohol consumption is also rising. So this combination of a genetic predisposition to metabolic syndrome, I don't want to go into the details of that, but rest to say that, close to 30 to 50% of our population has a genetic change in our genes which predisposes us to developing metabolic syndrome or fatty liver disease. This, in combination with a carbohydrate-based diet, not adequate exercise, and even small amounts of alcohol consumption, can lead to a liver problem. And even in the absence of consuming alcohol, the remaining 3 factors which I mentioned itself are enough to cause fatty liver disease. Now, how are we going to prevent it? Prevention is very simple, and this is something which, if I can summarize in one line, what is good for the heart is better for the liver. I keep saying this numerous times, and we know that eating moderate, a protein-rich diet, low carbohydrate, zero sugar, moderate exercise, these are all good for the heart. Even before they're good for the heart, all these lifestyle practices, if I can put it, rather than change it, if these lifestyle practices will actually help you keep your liver healthy. There'll be no fat accumulating in the liver, because it's not what you eat, it's actually how you spend the calories that you eat that is important. So just fasting actually is known to promote fatty liver disease. I think intermittent fasting is a completely another topic. Maybe we'll talk about it at another time. But spending the calories that you consume is actually key. And calories which are dense, which are derived from protein, are much better. And certainly vegetarian protein is much better than animal protein. And certainly protein which is not fried, deep fried, which doesn't have salt in it, is actually the best form of protein. And if you spend the calories which you accumulate from these food sources, you're likely to keep your liver very healthy, and certainly no alcohol. So these are the 3 important things that I would send the message across to the young population now, in whom certainly we are seeing a big rise in fatty liver disease, and this is due to a metabolic problem. And to prevent these metabolic problems, the 3 key aspects are no sugar, low carbohydrates, no refined sugars or carbs, high protein diet, and moderate amount of exercise. Now, how much exercise is good for you? This is a very, very important thing. See, I think what I would like to caution youngsters out there is not to exercise when you're tired, especially when you've been working, or you are playing, you've had a late night, and you've not had adequate sleep, and you're not feeling well enough. Certainly, you should not exercise early next day morning. And it is a false idea, to think that strenuous exercise is good for you. No, it is not actually. There have been various studies, especially from the West and also from Australia. Although we don't have the data from India, I'm sure it will not be different here. Moderate exercise is what is needed for us. And we are all human beings. We are not cheetahs, or we are not gorillas, or we are not any other type of animals. And we need to adapt our exercise to who we are as a species. And this is very important. And by moderate exercise, what experts mean is that, there is something called a target heart rate, which is 220 minus our age. So if I am 50 years of age, and 220 minus 50 is 170, 170 is my maximum heart rate. What does this mean? This is the heart rate at which my body switches over from using blood sugar to breaking down my muscle to give me energy to do the exercise. And this is when aerobic metabolism changes to anaerobic metabolism. We should not reach this stage. So what is recommended is 20% below the target heart rate. So, that is the maximum that we need to aim for. So for me, 170 minus 34. So, you can work around about 130 is the heart rate. The ideal exercise for you is when you exercise at 50% of your target heart rate. So if my target heart rate is 170, I should exercise at around about half of that. And that you can do with sort of current exercise trainers. And only 15 to 20 minutes of that 4 times a week is more than enough to actually keep you going, provided you adhere to what I said earlier with regard to the diet. So diet, exercise, no or extremely little alcohol consumption, avoiding unnecessary health supplements. Health supplements are not needed if you eat a balanced diet. It's a fallacy to think that if you don't eat healthy and be consuming, boxes of multivitamins and health nutrients, you're going to be able to, stay healthy. In a balanced diet, you will get all the necessary nutrients that are needed for you. And certainly there is nothing in them that's going to prevent, fatty liver disease.